Hey everybody, this is Tom Jones Pharmacist live, and tonight we've got a treat for you. We're going to talk about thyroid. Thyroid again, this is one of our favorite subjects, and we're going to talk about how you can be tested for thyroid. So let's go with it. We want to get ready and let you learn all about the thyroid test. Now, you know that thyroid disease comes in many forms. Most thyroid disorders include hypothyroidism and hyperthyroidism. Those two are the most prevalent, with hypo being a little bit more so. They have non-specific symptoms, and that can be difficult to diagnose. So as you're moving down the thyroid disease function, you want to actually have your body tell you as much as you can be told. You also want to have your body be tested for the items that will need to be tested. So, with that being said, if you get the right test, then you're going to have the best outcomes and the best answers. So now, unexplained weight gain or unexplained weight loss, fatigue, depression are among the most common signs of thyroid dysfunction. So when you hit these symptoms may also include less serious conditions. If you have a family history of thyroid disease, you want to get some blood tests done. And the same goes for those who are over 60 years of age. So a lot of us need our thyroid checked every single time that we go to our physician. And if you've had your thyroid gland removed, you need to be tested. And you need to be tested if you've received treatment with radioactive iodine. Pregnant women and people who have autoimmune disorders also need their thyroid checked, and they're at risk also. So here are some of the main types of thyroid tests that you need to have done, and we're going to just go over them each one. TSH, that's the one that most doctors actually test for. TSH is your thyroid stimulating hormone, and these levels are an indicator of your thyroid function and disease. If your TSH is high, too high, it means that you have an underactive thyroid, so it's reverse. So if the TSH is elevated, that means the thyroid is acting in less motion. THS levels that are usually shown in people who have overactive thyroid, which they can progress to hyperthyroidism. So according to the health experts, TSH is the gold standard for thyroid disease diagnosis. However, this test alone really doesn't provide a complete picture of how the individual is doing with the thyroid. Many people experience fatigue and other signs of thyroid dysfunction, and they have normal TSHs. So, whoa, their levels show a normal range. And additionally, TSH labs ranges are actually controversial, because this was a test that they did a long time ago, and they checked with the medical students to see how everybody's normal thyroid was functioning. So That's how they actually came about the TSH test. Sometimes low TSH levels may result from a dysfunction of the pituitary gland. So there's lots of reasons as to why TSHs sometimes don't tell all the picture. So if you want to really get down to the nitty-gritty of the whole process and rid yourself of any doubts, request a full thyroid blood panel. And then you get more tests. One of the tests that you'll be getting if you do the whole panel is the T4 test. And the T4, which is thyroxine, that helps diagnose hypothyroidism. T4 levels that are below normal indicate an underactive thyroid. The normal levels range from 5 to 13.5 micrograms per deciliter. And however, these numbers vary from one lab to another. So all labs are not equal in this process. Another test that you'll probably have if you want a whole panel is the T3 test. Now, T3 and T4 are thyroid hormones. The T4 being the inactive form, the thyroxine, the levothyroxine, and the T3 being the active form, the triiodothyroxine. So that's actually diagnosing the T3 levels would diagnose hyperthyroidism. The normal limits are between 100 and 200 nanograms per deciliter. If your T3 levels are too high, that's T3, you might suffer from Graves' disease or an overactive thyroid. All right, let's keep going because that's not all of the tests. Another test is the T3RU test, which is referred to as the T3 resin uptake. And that measures the levels of thyroxine-binding globulin, the TBG, in your bloodstream. And if its levels are too high, you might have a protein deficiency or kidney problems. So abnormally low TBG levels indicate excess estrogen production, which can be caused by hormone replacement therapy, obesity, or a diet rich in estrogen-forming foods such as legumes, soy, and sugar. Let's keep going because that's not all. The next test is called the TG test. The TG stands for thyroglobulin. TG is in your system. The thyroglobulin is a protein produced by the thyroid cells. In general, the TG test is recommended for people who have their thyroid removed after cancer diagnosis and helps determine thyroid function at that point. There's another test called the TSI test. And the TSI test is the thyroid stimulating immunoglobulin. And that's a test that indicates whether or not you have recovered from hyperthyroidism. That's too high of thyroid. It also measures the level of the TSI, an antibody present in Graves' disease. Be aware that none of these tests are 100% accurate. Lab errors, subtle hormone imbalances, outdated TSH lab ranges, thyroid hormone resistance. Now, here's the first time we've heard that. That can affect your results. This means that your test levels and results can be normal even if you have thyroid disease. In case you still experience symptoms after having these tests done, get tested again and request a more in-depth evaluation and examination. Consider switching your doctor or your lab if necessary. You know your body better than anybody else in the entire world. Your body basically is going to tell you if something's wrong. If something doesn't feel right, get second, third, fourth opinions if it's necessary. You need to be your own advocate. And always, always, always trust your instincts. You know your body better than anybody else. And when you don't feel good, you want to find out what is causing you not to feel good. Well, we went over some laboratory tests tonight, and that's super, super important. I want to thank you so much for being right here with us. My name is Tom Jones, Pharmacist, and my goal is to teach you everything that I can teach you, and for you to be your own advocate. Take your body and be in charge of it. Be in charge of it. Get the feeling better. We love you very much. Have a wonderful day, and talk to you soon. My name is Tom.